Good evening. I'm Dr. Nikita Deshmukh. I'm an ENT surgeon and pediatric ENT. Today, I just wanted to discuss about certain problems which are related to the season. Whenever there's a season change, especially in the rainy season, we see a rise in the number of cases of fever. High grade fever is very common, and in this current scenario, high grade fever usually is because of COVID. This wave, what we are seeing is that high fever like 103 and 104 fever has been recorded in COVID cases. Apart from that, simple viral infection also presents with high grade fever, and it usually lasts for 2 to 3 days, and it is self limiting, so we don't have to worry about this kind of fevers. But if the fever persists for more than 3 days, then you have to investigate, because there are other possibilities as well. It can be dengue, typhoid, or urinary tract infection. These are the usual possibilities. Especially in children, dengue is very common. Now, what do you mean by dengue, and what are the things that we have to really look at which will point out towards dengue? The first stage in dengue is the febrile stage, that is when there is fever, and after 2 to 3 days or maximum 4 days the fever starts coming down, and after that the hemorrhagic stage starts. In that, what happens, the platelets start dropping. So as a result of that, the child may get rashes on the body or nasal bleeding. Sometimes even other presentations are also common, like they might develop gums bleeding and other sites from which suddenly the bleeding starts. So if any of these symptoms happens, then you should be very careful. Another important point that I want to put across now is, if there is fever associated with cold, the cold has a tendency to go into the ears through the eustachian tube. So ear pain also happens. So as soon as your child catches cold and has fever, you should start giving some medicine for cold and encourage the child to blow the nose out and take steam inhalation, so that the later complications like ear pain, ear infection and perforation of the eardrum can be prevented. The second thing is typhoid. The typhoid patients also are common, and in typhoid the fever is extremely high grade and usually it does not come back to the baseline, and it is often associated with some history of having outside food or vomiting or a stomach upset. So typhoid also can be detected by simple blood tests. So when to do the blood test? Only if the fever does not come down for 3 days or so, then you should go ahead and get the fever profile done. So do not panic if there is fever, but you have to be careful. You cannot allow the fever to rise above 102, 103. So in those cases, we give along with paracetamol, Meftal also if the fever is going too high. And what is important is sponging and adequate hydration of the child. Now, below 4 to 5 years of age, there is also a risk of febrile convulsion. So you have to be extremely careful if the fever is going very high, especially in the pediatric age group. In adults also, it's exactly the same scenario, but in children, obviously when a child gets fever, all of us tend to panic. And the another important thing is, children have got a very good tolerance level for fever, so they usually don't complain, they just keep playing around, and when the fever reaches really high like 101, 102, that is the time when they start becoming restless. So we have to monitor their fever extremely well. So these are a few things which I wanted to bring across. That is the reason I have made this video. And in view of the rising COVID cases, I request one and all to start using masks again, especially in closed spaces, and have adequate sanitization. Thank you.